Hey everyone, welcome back and let's discuss our new topic today, that is our osteoarthritis. So osteoarthritis, that is the most common joint disease. So osteoarthritis is what that is the most common joint disease. So remember, the osteoarthritis, that is what that is the most common joint disease, and this is also known as degenerative process of cartilage. This is also known as degenerative degenerative disease of cartilage. Now what happened when the cartilage will be degenerated or the cartilage will be damaged. So these cartilage they present between the bones and they prevent the friction between the bones, or they prevent the rubbing of bone with each other. So this when the cartilage will be damaged, so there the bones will rub with each other. The bones will rub with each other, and this rubbing of the bones will produce a sound, that is like tickling sounds will be produced like during the sweating sound during the sweating, and the patients will having the pain, and that is the severe pain we will see. All these things we will be able to see. Other sign and symptoms, what we will see, other sign and symptoms we will able to see in these conditions. What are these are the like we have the subchondral sclerosis. We will able to see the subchondral sclerosis. We can see the necrosis tissue or the necrosis of the bone, and we can see there is a cyst formations as well in case of osteoarthritis. So osteoarthritis, we will know what is the arthritis and the see there is a two things. One is arthritis and another is arthralgia. Arthralgia. So when you see the arthritis, so arthritis means there is inflammation plus pain is there. But if we talk about the arthralgia, arthralgia means only pain will be there. So of course we will having the inflammations and the pain will be there in case of osteoarthritis. Along with that, we can see that there is a subchondral sclerosis, as well as we can see the necrosis of the tissues and the cyst. The another point you can remember here, that is the most common joint. The most common joint involved in case of osteoarthritis. So that is our knee joint. That is our knee joints. So the knee joint is the most common joint that affected in case of osteoarthritis. And also remember the MCP joint will be spared. The MCP joint will be spared or not affected in will be spared or not affected. So remember, MCP is the most common joint affected in the rheumatoid arthritis. But in case of osteoarthritis, they will be spared and they will be not affected. So remember these things. Along with that, we know that due to degenerative process of the cartilage, we see there is a rubbing will be there. So the joint space narrowing also seen in these conditions. So when we will see the some deformities, so what deformity we will able to see in these conditions, we will see there is a Bouchard's nodes, Bouchard's Bouchard's node, and we will able to see the Haberden nodes, Bouchard's nodes and Haberden node. See, Bouchard means B. B comes first, so proximal comes first. The proximal interphalangeal joint. Haberden node they present at the DIP, distal interphalangeal joint. So remember Bouchard's node. So Bouchard's node B comes first, so we have the proximal. See, this is proximal, this is proximal, this is distal. This is proximal and this is distal. The proximal distal. So proximal comes first. From here, the joint from our body, the proximal comes first, and distal is away. So remember, the proximal comes first. That's why it is the Boucher's nodes. The DIP, remember, that is the Haberden nodes. Okay, I hope you understand these things. Now let's see the images. Along with that, one more thing you can remember here, that in case of osteoarthritis, we will able to see the genu varum. What is the genu varum? See, when we are seeing there is on the medial side, we will see there is a narrowing will be more, or due to which there will be the rum, like if you fit the rum. So when the rum will be there, the patient will be having something like this. So you can remember the rum makes your knees spread apart. So that is the varum. And vulgum also it occur in the it can be the in case of the elbow condition also, and it can be the knee conditions also. So you need to remember these things. See, well, what the gums do, it make your knees stick together. It make your knees stick together. So in the gums, we will see like this type of the pattern, but rum it's spread apart. So we will see this type of the patterns. We see this type of the patterns, and the varum is the most common deformity in this case that is seen in case of osteoarthritis. So this is the patient images. So this is the valgum and this is varum. Again, one bottle is there, so you can remember the one bottle can fit here. So this is also known as the bow-legged, and this is known as the knock knee. This is also known as the knock knee. See, we talk about the nodes. Then now see the this is the Boucher's nodes and this is the Haberden nodes. See the Boucher's nodes I told at the PIP and Haberden nodes, remember that it is present at the DIP. Okay, this is what this is carpo metacarpal joint. Carpo metacarpal joint. Okay, so we are finishing our osteoarthritis topic here. And if you have any query about anything, you can ask me at the rate Medic Mukul, and also you can follow me there. And thank you so much for watching this. See you in the next video. The next topic will be the ankylosing spondylitis. So see you there. Bye bye. Hare Krishna. Take care.